My name is Joanne Basham, and I am a firm supporter of physician-assisted suicide. One of the main reasons that I feel this way is because I have a father who was diagnosed with Alzheimer's, early onset, when he was 55 years old. And I watched my mom care for my dad for 20 years while he suffered his loss of memory and deteriorated in health until he died at the age of 75 from pneumonia. He did not have the choice to be able to choose how he would live out his final years. And I know my dad. My dad is a person who wouldn't have wanted to live like that. So that's why I feel so strongly that physician-assisted suicide is an option that should be there for people who are mentally competent, who could make that choice, who are suffering unbearable pain, and who cannot be cured. I think it's a valid option for them. And there are a lot of different reasons why, and there are a lot of different things that support this opinion. Physician-assisted suicide is defined as suicide that is assisted by a doctor by a couple of different means. One way is they can write a prescription for the patient to take the drugs themselves at a time of their choosing. And then the other way is where they would administer the drug to the patient at a specific time and place. There are a lot of safeguards in place to where doctors would not be able to just issue a prescription to just anybody. There are requirements in place that require 2 oral requests by the patient, that they have to have a written request with witnesses to the physician asking for the physician-assisted suicide medications. 2 doctors have to confirm the diagnosis that they are incurable. And then the other thing is they have to be made aware of all options. So any kind of treatment that's available to them or any type of palliative care that could make them more comfortable, they have to be made aware of all of those things so that they have a really good idea of what their options are before they make that choice. So it is really regulated and not just something that people can off the top of their heads request and then it happens and they don't have time to think about it. Who are we to say no to someone who has unbearable suffering and an incurable disease? In Massachusetts, in September, the legislature was considering physician-assisted suicide, and a bunch of people testified, but Representative Chris Walsh of Framingham was actually on the committee, and he doesn't have an incurable disease, but he has a disease that has that possibility of diagnosis in the future. And he said he would want the option to choose how he dies. So he's a person who has a personal stake in what the decision will be in Massachusetts. Michael Martignetti, who has a nervous system disease, he said, "What awaits me at the end of my life is more than I can handle." And I think each person knows their ability to handle pain and suffering and in a way that no other person could ever tell. In fact, there was a study done, and it is, it is in the Journal of Medical Ethics from June 2011. It was a qualitative study where they were trying to determine whether or not a doctor could diagnose unbearable suffering. And what they discovered was there was no way to to actually diagnose unbearable suffering. There just isn't a way to do it. And they combed through testimony from different doctors and patients and just could not come to a scientific way of diagnosing that. So it's something that the patient has to discern for themselves and know. In America, one of the first states that legalized physician-assisted suicide is Oregon, and every year they release their statistics for how many people chose this option and how many people died from it. In 2015, there were 218 prescriptions given for physician-assisted suicide. Of the 218, 125 of them took the medications and ended their lives, and 7 people from previous years did that. The rest of the people who got the prescriptions ended up dying of other causes and never actually used the medications. So it's not as if they're issuing thousands and thousands of these. Each year is very limited amount of people who are taking advantage of it, but it is an option for them in Oregon, and it's something that they can choose rather than just dying of an incurable illness in great pain. In a survey on verywell.com, the reasons that people choose that the majority of people choose physician-assisted suicide are that 90% of them can't enjoy the normal life activities that make their lives happy. Also, 90% cite the loss of autonomy as one of the main reasons that they're making this choice. 65% of people just choose loss of dignity. It's hard to imagine how it would be to have someone else doing everything for you at the end of your life and not having any choice or any way of doing things for yourself. And so I think that's something that we don't think about. And in addition to that, when you do lose your autonomy, when you lose your dignity, when you lose your enjoyment of everyday activities, it can cause depression that it is something that you and I couldn't even imagine. And for someone to be able to deal with that is a personal decision. Some people just can't get by knowing that this is how they're going to live the rest of their life. And the option for them to be able to exit at their own choosing is just an invaluable choice for them. The other things, there are positives that go along with just being able to grant somebody their wish of being able to die when they want. The other things that are that you have to think about are the resources that we are spending on extending the life of someone who has no hope of being cured. Families often are drained financially by the medications and the round-the-clock care that go along with end-of-life suffering. And that's something that you and I may not think about, but when you have to carry the burden of full-time care for someone in your family and expensive medications, it may be something that they just don't have the resources to do. Another issue is doctors are spending their time with these patients who have no hope of being cured. Doctors' time is expensive and valuable. If they can use their time to be working with patients who have a chance of being cured, who may have something that they can discover that they can do for them, isn't their time better spent doing that? The other thing is that if a patient is someone who is choosing to have organ donation, after they pass away, they're donating their organs. If someone chooses when they're when they're going to pass away, their organs are going to be in better shape than if they continue to deteriorate and die naturally. So the chances of having organ donation happen increase with physician-assisted suicide as well. I think all of these reasons are very valid reasons for someone to be allowed to have the choice to end their life at the time of their choosing and not have to suffer unbearably until the end of their life. And I hope that you agree with me. I hope that if a measure comes in your state where you can vote and have the opportunity to give people in your state the choice to have physician-assisted suicide, I hope that you decide to vote in favor of it.